Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the episode for you today? As promised, I'm bringing you plastic surgeons from across the country who can deliver amazing results for you. And today, I'm super excited to have Dr. Bill Kortesis on the show. He is a board-certified plastic surgeon out of North Carolina, and you guys are in for a treat. Thank you for being on the show, Dr. Kortesis.
No, thank you for having me. I'm super excited to be here.
Me too. I want to start this episode off by first, I'd love to get to know you. Why don't you tell us a little bit about yourself and your roots and how you decided to become a plastic surgeon?
Great. I grew up in North Carolina, so I was born and raised here. My parents were both immigrants from Greece, so I'm first generation Greek American. So Greek roots, really, proud of my culture and who I am and where I come from. Very religious. I'm Greek Orthodox as well. So we go to church regularly, and that my faith is super important to myself and who I am. It's one of my pillars of how I take care of people and patients as a whole. But I grew up in North Carolina, and I knew early on, I was like, I'm going to be a doctor, no doubt. I just, and I was like, I'm going to be a doctor, but I had no clue whatsoever what sort of doctor I wanted to be. And so going into medical school, I was just like, I loved everything. I'm like, I'm going to be a radiologist one day. No, I actually love urology. CT surgery is the best. So I was one of those guys that I changed my mind all the time. But then I realized I'm like, all right, I'm definitely a surgeon. It's like I like to be in the OR. I like to do procedures. But I had no clue what type of surgery specialty I ended up wanting to do. And so I was like, I'll just end up being a general surgeon, and then I'll decide from there where I ultimately want to lead this. Then it was my last year of medical school. I did a rotation in plastics, and it was like an aha moment. That day, my first day, we ended up doing a breast reconstruction for a patient who had breast cancer. We ended up doing a kid with a cleft lip and cleft palate. We had a trauma that came in with somebody who had a hand injury. I'm like, oh my goodness, I get to operate on all people, all ages, women, children, men, and all body parts. I'm like, this is it. And so I fell in love with plastic surgery that day, and I never looked back.
I love to hear that. So I bet that's how you got listed as one of Newsweek's top surgeons in the US, just that passion behind it. I love to hear it. So today's episode, you guys, we're going to be talking about one of the procedures that I hear y'all asking me in my DMs, and it's surgery after massive weight loss. And Dr. Kortesis is an expert at this. He does all body surgeries. And today I wanted to talk about an abdominoplasty consultation that ends with a Fleur-de-Lis recommendation. And as I know my girls are out there, they're on their weight loss journeys, and they're thinking about what surgery is the one that's going to give me the results that I want. And I know that's such a loaded question because everybody wants different things, but for the most part, when women come in to see a plastic surgeon, they want kind of rewind the clock and be back in their youth. So, Dr. Kortesis, how do you decide usually in a consultation between a patient who is a good candidate for something like a mini tummy tuck versus a Fleur-de-Lis versus an extended abdominoplasty? How do you, as a plastic surgeon, how do you decipher what's the best option for them?
I think it's really important to sit down and, like we do with every patient, really understand exactly what they're looking for, right? As you know, you've been doing this for a while. Patients come in and they have different goals and desires. And so I think as a surgeon, you really have to sit back and understand where that patient is coming from. You have to get to know them. We have a short window that we're chatting with them. So you really got to get under the hood as best as possible to really understand, why they made that decision to come see you. And what are their end outcome that they ultimately want to get. And I think we actually see a ton of massive weight loss patients. And it's quite amazing. Most of them have gone down this road and didn't realize what they would end up looking like when they lost their weight. And they didn't know how they would feel about their bodies once they lost all this weight. And I think they're refreshed to find out the options that are available to them once they come see a plastic surgeon who's got extreme experience in this. So and with any body contouring, you really have to figure out, okay, what are the things you can change on a woman's body or a man's body, and how do we use those tools that we have in our experience to be able to elicit those changes? One is skin removal, right? And I always tell everybody, the bigger the incision you ultimately make, the more skin you can remove. So that really, the incision itself is purely determined by the amount of skin excess that the patient has. If they have a little skin excess, you can make a small incision. If they have a lot of skin excess, you need to make a big incision. So that usually determines whether or not we do what's called a mini or a small version of a tummy tuck versus one that we go all the way around for. And I can go ahead and tell you, most weight loss patients are not going to be mini tummy tuck candidates. And in my experience, I've done probably 400 to 500 tummy tucks a year. There are very few patients that are mini tummy tuck candidates. There's some nuances with that, and we can go down the road of some of the nuances between a mini and a full. But just to understand, so for your audience to know, if you're doing a mini tummy tuck, you have to lower that belly button a little bit. So what we typically do is what's called an umbilical float, where you free the stalk up from its attachments, and then you remove some skin, and that belly button lowers. And you can only lower it about 1 centimeter, because if you go below that, it looks really awkward. So you need to be within 1 centimeter of where your normal belly button is. And by doing so, all the amount of skin you can remove is typically about this much. Maybe this much, depending on the amount of overhang that the patient has. And what I found is the reason why there's not a lot of people that qualify for that is most patients, the area of laxity, which has the skin that needs to be removed, is above their belly button. So you would imagine when you try to pull that down and you're only moving the belly button about this much, you still have all this laxity above your belly button. So in those cases, they're really not great mini tummy tuck candidates. That's why most patients, and if you're especially on those patients that are on the edge between a mini tummy tuck candidate versus a full tummy tuck candidate, they would prefer to have what we call a vertical scar versus to have that laxity up top. And that's one of the first things I ask patients if they are in that in-between land of skin laxity to do a full versus a mini tummy tuck. I'm like, hey, would you prefer to have a little bit of movement up here, or would you prefer to have a small little vertical scar beneath your belly, beneath your bikini line? And guess what? What most of them choose, right?
Yeah, for sure. I always say skip the mini, just go with the full.
I mean, and I'll tell you, it's funny that when I first started practice, I used to do a ton of them, and I converted most of those to full tummy tucks, like over 90%. So it's few and far between.
After time, they came back and they were like, you know what, let's just go for it.
Correct, because they still had that laxity above their belly button that they didn't like.
I have somebody who I just had a conversation with earlier this week that this is exactly the situation she's in. She had a mini and she should have had the full. But, they're afraid of the scar.
Correct.
And that's I think, sorry, I'll let you continue. That's the number one thing that I hear that they're worried about.
But, you bring up a really valid point. I mean, it's a scar, but like you're still having a scar with a mini. The scar of a mini is still going to be like this versus a full. You're adding about this per side. So it's really not that much of a difference.
And I think the result is a lot better. Like the trade-off of the extension of that scar for the amplified results, I think is a very good trade-off.
Without a doubt. So I would tell you it's few and far between at this point. knowing what I know, that I would recommend a mini tummy tuck for.
You know what? This is totally off topic, but on topic. What are your thoughts on reverse tummy tucks?
So I do a lot of them, and I think
Okay, I love to hear it.
I think they're fantastic. If a patient has already had a breast lift, or already has those scars of a breast lift, or needs one, it's kind of a no-brainer to do, because you could do what we call a mini reverse tummy tuck, where you just keep the scars and within the creases of the breast, because they already have those scars anyway. Or if they want a full one, you just have to have the middle extension, which if you put it in the right spot, heals remarkably well, and you can hide it underneath a bikini or a bra.
And a bra. So I've actually, reverse tummy tucks have been just as popular in my DMs as the Fleur-de-Lis, just because I think a lot more surgeons are showing their reverse tummy tuck results. And I think a lot of women think that that's the right procedure for them, since they don't want that long scar underneath. And I don't think there's that real understanding of it's not the same.
No, I think it's for the people that have laxity above their belly button, but only a small amount, right? I think those are the great cases for a reverse. The same concepts apply to the reverse as it does a mini. If you're doing a traditional reverse and you have to float the belly button, you can only raise it about a centimeter before it looks awkward. So by doing so, you're not going to be removing that much skin. So if you have a big skin issue, a reverse is not going to answer you. It's going to be more, you need to do more of a traditional tummy tuck. So, back to your original questions, like how do you determine, we figured out between a mini and a full pretty easily. Then it's like, all right, how do you go from a full to an extended to a 360? And again, it's really about the amount of laxity. If you're a massive weight loss, I'm going to go ahead and tell you probably have laxity in your buttocks, in your lower back, and on your sides. And in those cases, you do so much better by doing a 360 or an extended, because by extending that scar, you get more of that excess skin out. But you can also shape and contour the patient, which I love. I mean, that's the whole purpose behind doing this, is so we can give them more of that hourglass shape in the front. And what's amazing is, and people don't realize it, people that do a lot of body lifts know, but by doing a traditional 360 tummy tuck, you actually make the front side better when you do the back extension. It is remarkable. I see my patients that have done a traditional tummy tuck on versus the ones that we've done 360. And by removing that excess skin on the sides, it is a tremendous difference in terms of shaping.
I love to hear that. And also, do you do a lot of fat grafting with combination procedures?
Yeah, I think ultimately, if you're going to do this, and I was just talking to a patient about this today, sometimes if you're removing a lot of skin from the top part of the buttocks when doing a buttocks lift or a 360 tummy tuck body lift, you can sometimes flatten the buttocks. Mm-hmm. So there's a couple of ways to avoid that. One is by fat grafting, which I think is probably, in my interpretation and my experience, the best option. So you do the skin excision as well as fat grafting all at the same time. Or you can use that tissue that you normally would just throw away, but reshape it into kind of what would look like a buttocks implant to do what we call an auto augmentation. And again, we've done both in our practice and they've both done really well. My preference is to fat graft, because everybody always has a little extra fat somewhere that they want to get rid of.
Can you do both auto-aug with fat grafting, or is it one or the other?
No, you can do both. So you can do all the above. It really, again, it goes back to that original point of what I was saying of what is the patient looking for? Do they want a big bottom? They just want a little bit more shapely of a bottom? Or do they want people to go, okay, she's gotten some done? Mm-hmm. And as every patient is slightly different. And we have to listen to what they want and give them, the patient, exactly what they're looking for.
Tell me if this happens to you, Dr. Kortesis, where a patient comes to see you and they tell you, I want to look natural. And then they show you their wish pic and you can clearly tell that person is not natural.
Never happens. No, it is very routine. They're like, I want the smallest implant possible, but then the pictures they show you is somebody who has 600-700s. But it's same with the buttocks, right? They're like, hey, I just want a little shape. And then they show me pictures of somebody who's like, okay, this one 100% had a buttocks implant.
I'm glad I'm not the only one who has that happen to them. With the Fleur-de-Lis, how do you usually decide between a 360 abdominoplasty or a three circumferential lift versus a Fleur-de-Lis?
So yeah, what's interesting is, in my experience and what I've seen, about half my patients opt to do the Fleur-de-Lis and half don't. And most of them that do not are very scar averse and they want to hide the scar as much as possible. And so the way a vast majority of weight loss patients are candidates for the Fleur-de-Lis. And the way I show them is I have them look in the mirror. I push down that excess skin that's right above their belly button, and then I show them the laxity that's above their belly button. And I say, hey, are you comfortable with this amount of laxity? If you are, then you don't need to do the vertical component of the 360. Now, if you don't want this laxity, and then I pinch how much I can ultimately take out with doing a Fleur-de-Lis, and I said, you may want it more like this. Now, you let them feel the side that's taut, then we need to do that. And again, in my experience, about half the people say, yep, let's do the scar. I don't care. I want all skin gone. And half are like, no, I don't want to deal with that. So it really is determined by the patient and if they're comfortable with the amount of laxity that they have above their belly button.
That's a very good gauge. I feel the patient's comfort with the scars, and are they going to be comfortable with the laxity that's left if they don't do it?
Yeah, I would tell you that, I never talk a patient into doing one thing or the other. And I think that's where we fail as surgeons. I think the traditional model of saying, no, you have to do this is gone. And it's more of this conversational piece between the surgeon and the patient. And it's up to the surgeon to deliver the message of what they can do surgically to see if that's what was going to make the patient happy. Yeah. And I always say, if there's a disconnect between those two, you shouldn't do the surgery. On either point, either from the patient side or the surgeon side. If you're like, what the patient's looking for, the surgeon can't do, that's a no-go. If the patient wants something, it's just like they have to match. Absolutely. Like hand in glove.
I tell my girls, when you are going to your consultations, you're interviewing the surgeon to see if this is the right fit for you. But on the flip side, they're also interviewing you to make sure that you're a right fit for them, that they can deliver the results that you're expecting, or that your expectations are within something that they can deliver, and that they're reasonable expectations for a surgical procedure. I like to tell my girls, be on your best behavior when you go in there. Don't act crazy, because they're not going to take you.
And it's okay to say, for one surgeon to say no, because you know what? There's probably another surgeon out there for you that does it better. And before the show started, we were just chatting about, I think patients should go to surgeons who are specialists in that particular genre of things, right? If you don't want to go to a plastic surgeon who only does 3 to 4 rhinoplasties a year, that's not your rhinoplasty surgeon. It's just the way it is. And, if somebody says, oh, I can do it in my sleep, I've been trained on it. No, you don't want to go there. This is what they do all day long. And the reason for it is things arise all the time. Complications can happen, even in the best of hands. And you want somebody who knows and understands every nuance to be able to take care of you the right way.
Absolutely.
So for me, I do a ton of weight loss patients, and I feel very comfortable and confident with every single weight loss procedures that are out there. But again, I don't do a ton of rhinoplasties. And if you came to me for a rhinoplasty, I would end up referring you to one of my partners in my practice. And that's just kind of how we do things.
And I like that. Please tell me where you would go. Who would you let do your nose? And that's where I'll go. So since you're an expert in weight loss procedures, or procedures after weight loss, one of the top procedures that I hear a lot of my girls talking about is breast deflation. Their breasts have deflated completely after their weight loss, and now they want to reconstruct, but they a lot of times don't have any fat for any They barely have any fat on them. Or if they do, it's not enough to build them a breast tissue to build them a nice mound for a breast. So that's conversations that I just had recently, actually, this week about breast reconstruction after weight loss. So I'd love for you to talk to us a little bit about what are patients' options, what can they do when they have lost all the elasticity in their skin, what are their options?
I think breast surgery after massive weight loss is probably one of the most difficult breast surgeries that plastic surgeons can do. And again, just like we were talking about with the rest of the body, there are nuances with this. And part of it is really trying to figure out exactly what that patient wants. But what we're trying to do is create structure to the breast that has lost structure. Now, not only as a skin stretch, but they lost volume and there's no physical structure to that breast. And so ultimately, that's what we're trying to recreate. And one of the best ways to do that is one, through a breast lift or a breast reduction. So we ultimately need to remove all that excess skin and tissue and move the breast back into the position that it ultimately needs to be in. But in addition to that, most of the time we need to restore the volume to give the breast a little bit more structure. And there's two ways to restore volume. One is with an implant and one is with fat grafting. And sometimes it's a combination of both, right? What we call a composite augmentation or hybrid augmentation. And again, really you need to go to somebody or surgeon who does this all the time, because you need to figure out exactly where the volume is lost. If a patient needs volume, centrally, a lot of times you need to do that with fat grafting and an implant. You want the implant for what we refer to as core projection, so you can get that projection back where you ultimately need it, and then you use fat grafting more of a supplemental approach to fill in the gaps of places where you've lost a lot of volume. But what you don't want to do is fill it up too much where you end up causing recurrent ptosis, or where that breast falls way too quickly. And one of the best ways to prevent that from occurring is to put some structure in there that provides soft tissue support. And, these mesh products that are available right now are really good to provide soft tissue support in those individuals. And I think that is one of the main indications in my practice to use the mesh product is in my massive weight loss patients, because I really want to maintain that structure as much as I can for as long as I can. So it's typically some version of a lift and implant with mesh.
Perfect. I love it. I love that combo. I want to ask you this before we end our episode. I want to hear one of your favorite patient transformation stories. I know my favorite patients are massive weight loss patients, because I love watching them transform. What has been your favorite that you've seen in your practice?
I mean, I can tell you they're all unique and special in their own way. And I would say it's probably one of my first ones that I did. The patient, I was young in my practice, learning and getting my sea legs about me. And the patient was crying. It was like week 2 and like full tears. And I was really worried. I was like, oh my God, what is going on? Something happened. Are you really upset with me? Are you mad? What did I do to you? And it was the first time somebody cried tears of joy in my room. And it was just mind blowing to me. And it wasn't the first time after that, but it was the first time. But after that, it was one of these routine things. Patients didn't realize how great they could look, because sometimes in their mind they saw themselves at their heaviest weight person. They didn't see themselves in this new body, and once they saw themselves with this new body, it was just this overwhelming joy. And I still remember that to this day, and what great of a feeling. And I looked at her and go, "This is why we do what we do. This is it." This is why we went through all the schooling. We do all this hard work, is so we can elicit these emotional changes in patients so that they can live their life in their new body how they always wanted to live.
So happy. And they go on to live like the happiest, best, most exciting lives now with their newfound confidence. I love it. Okay. So I know that you have with HKB a fellowship program. And I would love to hear about that, about your fellowship program. We have plastic surgeons and residents. We have all types of people who listen to the show. And I would love for them to know a little bit more about what you have in your practice.
So yeah, we have 3 fellows a year that we take, and we really believe in giving back to the community. And we know that it's super important to teach this next generation of plastic surgeons, so that patients can continue to receive the care that they ultimately deserve long term. And education is a sacrifice. I've always been taught that, and it's not. Education not for the faint of heart. You have to dedicate your time and energy and resources to be able to do it. But somebody helped me along my journey, and so I think we feel an obligation to give back to the younger generation to help them. And it's pretty rewarding. And the crazy thing is, I'll go and tell you, is they teach you too. It's surprising, right? You automatically just assume you're going to be the one teaching them, but it's this little interaction between the two that it keeps you on top of your game as well.
I love that, because my next question was, how does teaching help keep you growing in your practice?
So not only do we teach this fellowship, but we're really big believers in teaching nationally. So we're really involved in ASPS and ASAPs, and we're on the podium kind of sharing our techniques and our viewpoints of how things are. And we don't know everything, but I will go ahead and tell you, by being on the forefront, it forces you to be on the cutting edge of things and to maintain. I think some of the problems plastic surgeons have is they're like, oh, this is just the way I've been doing it forever. And they feel comfortable with that, and they're not evolving and changing. But as you know, because you talk to a lot of patients all the time, there's an evolution routinely, and what they want, their desires, the look, what is in, and there's new techniques being manifested. And so we have to stay on the forefront of all that to make sure that our patients are getting the best. Because that's the reason we're doing all this, right? We want our patients to have the ultimate best outcome.
Absolutely. One of the things that we talked about off air that I think is a great opportunity I want you to tell my audience about, is keeping your practice growing, but privately.
So we're been big believers that I think we're much stronger together than we are apart. What I found is I joined an older gentleman at the time, so it was just the 2 of us. And subsequently, we've now grown to 16 surgeons and twice the number of kind of mid-level providers in our kind of national platform that we have. And what we found is we are much better together. There's nothing wrong about being a solo practitioner, but sometimes you need a lending hand. And sometimes, again, you can't be a jack of all trades. You can't do a facelift, a rhinoplasty, and a circumferential tummy tuck and be the best at all that. And so we believe that specialization is unique and amazing, and that affords patients opportunity to stay within collectively one group that has a name and a brand and that you trust and value. That you know that you have a specialist in rhinoplasty, you have a specialist in deep plane facelifts, or you have the patient, the doc who knows how to do massive weight loss really well. So we're big believers in that. And, again, I have nothing bad to say about private equity, but our belief is currently that we want to be able to control the trajectory of how the space is driven. It can't always be about the bottom line and making as much revenue and profit as possible. Plastic surgery is unique and different, and you have to be able to take care of the patient. But more importantly, you have to take care of the provider. You want really good providers within your practice. And the only way to do that is if you give them a voice, you give them a chance for ownership, you give them a seat at the table to be able to direct how this is going to ultimately go. And we believe in this kind of growing so that we can better for patients, and as well as making sure that we take care of this new genre of plastic surgeon who wants to be involved but doesn't necessarily want to do all the HR or marketing, but wants a big, back office for support on all that good stuff. So that's kind of been our viewpoint about it all.
I love it. I love to hear it. And I'm very excited to see that out there. Just like I was explaining to you off air, I've seen the decline in patient interaction with the offices that have been purchased. So I'm excited to hear that y'all are keeping it private and you're patient centered. And that to me is the most exciting. So before I let you go, I always like to ask my surgeons this one question, and almost every single surgeon since I launched 5 years ago has been asked, are you team drains or no drains?
I do both, but I would definitely say if I had to choose, I'm a drain guy.
I love to hear it. I'm team drains 100%. I put the drains in me. They'll be out in a couple of days.
We do a ton of lipo with our body contouring. So I always found when you put a lot of tumescent in and you're lipoing a lot, there's a lot of dead space and you're better off using drains. That's just I've done it both ways, but I'm typically a drain guy.
I like to ask this question because for my girls, they've heard every single surgeon, almost every single surgeon answer that same question of, are you team drains or no drains? And most of the time they'll explain why, and the patient can go on and make their own decision on if are they hard, no drains. Because as you know, that's probably the number one thing that they don't like.
I've had a drain personally. I can speak from experience. They're no fun, but that being said, they're useful.
Very useful for sure. So if my girls want to come see you, how can they find you?
So visit hkbsurgery.com. That's our website. You can find me on Instagram at Dr. Bill Kortesis. And don't hesitate to look us up.
Sounds good. With that, you guys, I will see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.